But I think there's a lot of reasons to focus on corruption and procurement in health. We know that health is a particularly susceptible area for corruption because there is so much corruption, there is so much procurement that goes on within the health sector. And indeed, the National Health Insurance Program, which is supposed to be the site of health systems reform, depends a lot on procurement. And so it's really important that we watch what happens when there are big procurement contracts and ensure that there isn't corruption, that these processes are managed properly. And that's what the SIU is uncovering, that there has indeed been huge levels of corruption in this procurement. That's really worrying. It's something that we need to resolve in the interests of patients during COVID, but also more generally.
And what do you think, Mr. Halama, of the revelations of the SIU this afternoon?
Good afternoon, Tammy and Sasha. To be honest with you, these revelations are quite shocking. There's 189 reported cases so far, but we understand that there's more cases which will probably unravel even more allegations, more cases of corruption. It is a slap in the face of the health workers who stand in the front line, risking their lives, and only to find that there's PPE corruption, they're not getting sufficient PPE, even the quality, because I think it's something that Advocate Mutibi raised, that even the quality of the PPE that was procured by some of these service providers was below standard. And that puts the lives of health workers at risk. And that is quite shocking, Tammy.
And tell us about some of the stories that you've seen on the ground, how this level of corruption has actually directly affected health workers.
Well, some of our members, I think when the country went into lockdown and there was a lot of these tenders that were going up and down. And as Labour, we were demanding that health workers receive the sufficient PPE. And when the procurements were done, a lot of our members raised the red flags around some of the surgical gloves that were procured, would get images of gloves that were torn, would even hear stories of some of the masks that are not up to standard, your 3-layer masks that are not up to standard. Some of the sizes were inconsistent. I mean, in the Eastern Cape alone, I know that the EMS department, our members there were complaining a lot about the sizes of the cover coats that they had, that were being procured. And that eventually meant that members had to procure their own PPE. Some went as far as making a makeshift PPE using black plastic bags. And that stripped the dignity of some of these health workers when they have to go to work and now they have to makeshift some of the PPE. It is something that is quite shocking that our members raised during that time.
Ms. Stevenson, I mean, you as health rights program at Section 27, we saw a situation at the Tembisa Hospital where the nurses were basically not even doing their work because they didn't have the adequate PPE. Talk to us about the type of interventions that you feel need to be put in place to ensure a revolution in the healthcare sector and in procurement in that sector.
It was quite difficult to hear the question there, Tammy, but I think I got the gist of it. There's a lot of changes that are needed within our healthcare system to make it more equitable and to ensure that there are quality healthcare services available to everybody. Fixing some of the procurement issues is one of those interventions that's needed. Making sure that there is equitable distribution of healthcare services, and that includes, of course, at the moment, of vaccines. It includes equitable distribution of treatment and the kind of equipment that's needed to deal with COVID-19 and beyond. I think what we need to recognize and focus on are three things, really. The first is we need to resolve the governance issues in our healthcare system so that the processes for governance of the system are inclusive and have the kind of checks and balances that are needed. That protects healthcare users, it protects healthcare workers, it protects the funds that we spend on our healthcare system. Secondly, we need transparency. We need to know what contracts are being signed and with whom. We can't rely on the SIU, on investigative journalism to reveal these issues. We need proactive transparency so that everybody can be watching and we can be sure of what's happening within our health system. And thirdly, we need participation of healthcare users, of healthcare workers in decisions within the health system. These are the people who are really invested in our system, and we need to trust them and government needs to bring them into their confidence. So really there are these are not all simple, but there are some fairly simple solutions to resolving some of the ongoing problems that we see in our healthcare system. And the PPE procurement scandal is really a symptom of some of the deeper challenges that we have in the system.
And my last question to you, Mr. Halama, has there been a change in the quality and the consistency of the PPE that is being received by health workers since there has been a huge outcry on the lack thereof?
Well, to be honest with you, Tammy, there hasn't been much of a change. When you get to a point as a health worker that you stop complaining and you start resorting to procuring your own PPE, to ensuring that you do as much as you can to protect yourself, that is the mood that is on the ground, because even the health workers themselves that are receiving this PPE, they do not even trust the quality. And the snowball effect of that, Tammy, is that we're currently in a situation where we want to roll out the vaccination program. Because of the poor quality of the PPE, it has now planted in health workers' minds, even now, the quality of the vaccination that will be administered to them. You see, so it starts with a small order, but then it has a snowballing effect. Even the quality of the vaccination is now being questioned by many of the health workers. So really, government really needs to step up and tighten up on the procurement processes. I think something else that the newly appointed commissioner of the Public Service Commission, Dr. Fikeni, mentioned the other day, is that there needs to be a program of some sort that addresses the moral degeneration within the public sector, so that even the employees that are there, they have the ethical mindsets to ensure that when procurements are being done, they do understand the significance and of those procurements, because it affects so many lives when there's any irregularities of those contracts.
Certainly a snowball effect there. Thank you so much to both of you for your time and your insights this afternoon. Mr. Kevin Halama from Hospersa, as well as Mr. Sasha Stevenson, and she's at the Health Rights Program at